Good afternoon, and welcome to the City of Palm Coast virtual town hall meeting. We continue to be so pleased with those that are participating on our weekly town hall meetings. They provide such an unbelievable amount of detail and information to our residents as we continue to go through this COVID-19 global pandemic. Joining us today for the first time, I will say live, we do have our chief, our fire chief, Chief Forte, so welcome.
Good morning, Mayor and everybody.
Thank you so much. We continue to have our co-host. We have our health officer, Bob Snyder from the Health Department of Flagler County. Welcome.
Good afternoon, Mayor.
On the phone today, we also have our medical director, Dr. Stephen Bickle, who continues to really, frankly, provide such a level of detail for our residents and to our decision makers to allow us to continue to make decisions on the safety and health of our wellness and of our community. We're so grateful for both of you. And then we also have our city manager, Matt Morton. I also want to give a shout out to Matt. Today is Matt's birthday.
Happy birthday, Matt.
And so I'm sure this is the last place you thought you would be celebrating your birthday. However, happy birthday, and thanks for continuing to do all you're doing.
Thank you.
It means a lot. So as always, we are going to go into questions. I do want to say we have a couple things that are going on in Palm Coast that will hopefully continue to stay at home and heed the advice and the social distancing. I want to make sure that everybody knows about our Feed Palm Coast food drive that is currently going on. There are 2 collection locations. One is your city hall that is closed down, but it's your virtual city hall. So please drop off food items that are listed on our Facebook page and on our web page for those families in need. We'll be doing a drive for the residents that are in need on May 2nd at the 2 locations, Parkview Church, and as well as on Belterre, and as well as our City Hall. This is a tremendous effort for our community. Our residents need this now more than ever. We're looking to supply a week's worth of groceries for a family of 4. That will go a long way. Our goal is to feed 5,000 families on that day. Wow. That will have a tremendous amount of positive impact in those that are in dire need right now. So please, if you can, participate in the Feed Palm Coast food drive. And secondly, we have our Rise Up Palm Coast initiative. I would encourage you to sign up for that and to participate and watch all the great activities that our Parks and Rec team and our communications team have put together and assembled with different stakeholders in the community. So you can see performances at the Flagler Auditorium. You can see some cooking shows. You can see some healthy activities that you can do in the comfort of your own home on your YouTube channel, and ensure that not only you're staying safe and you're heeding the warnings and the advice of the professionals of our community, but you get to really see firsthand why Palm Coast and Flagler County is such a special place to live, work, and play. And so Rise Up Palm Coast initiative is going on currently as well. I know you provide an update, Bob. Did you want to provide an update at the beginning of this meeting of different cases?
Well, I can provide just a quick data update, Mayor. So statewide, 27,869 positive cases, 282,942 folks have been tested statewide. So the 27,869 positive cases is about a 10-11% rate at the moment. 867 deaths statewide. But more importantly, I want to talk about Flagler. 78 positive cases right now in Flagler. 1,054 people have been tested. So that's quite an increase over the last few days. We're doing the community testing, Mayor, at the Daytona State College Palm Coast campus. And we tested 119 people last week. Yesterday we tested 79. And so we're at it again today, thanks to so many partners that have made this possible. So we do expect more positive cases to surface over the next couple of weeks.
Well, I appreciate that update, and I appreciate your continued partnership. I think, that, again, the increase in testing is due to the relationship and the stakeholders that have been assembled to manage this crisis.
Absolutely.
So thank you very much. And to our Fire Chief, Chief Forte, I think it's important, since you're here today, just before we dive into the questions, to talk a little bit about, I know you've assigned a liaison from our fire department that is there to serve, if you want to mention Captain Asconi's role a little bit and how he's coordinated to ensure that we're managing it from our population of over 90,000 residents.
Thank you, Mayor. Captain Asconi's been with the department well over 22 years, and in that time, he's been instrumental in different areas, such as creating our EMS program, advancing the Advanced Life Support Program. It's truly in his blood and in his calling. And about a year and a half ago, we sent Tommy to Maryland to be part of an emergency management program, so that as we expand as a city, we become larger, and the city becomes even bigger developed, we can actually take the talents and tasks responsible for overseeing any kind of a problem that we would have in the city under multiple people. So it would either be myself or the deputy fire chief, or now we're including Captain Asconi. So when we started seeing this on the forefront in January, when the cases started to become available, and it was more on the news, and it was starting to leach out of Asia and into the European market, we looked at Tommy as one of those catalysts that can actually work with the county. He's got the background, the knowledge, the medical history, the true passion for what it is that we're doing. And we assigned him to be part of the initial liaison group to start the discussions. And this was early on. This was mid-January. I believe we were having these conversations. So at some point when the county decided to formulate a larger group, certainly Tommy was part of that. And as a department captain, he had the ability to interrelate with the county. He represented the department, and then soon thereafter, after Mr. Morton enacted our working group with the executive team, he became our liaison for the city. Easy transition from department to city. There are certain skill assets that folks can fall back on, and this is one of Captain Asconi's, one of his best attributes is working in the medical field. He can relate department operations to city government, into medical history, and then convene that. A lot of what we're doing are coming from recommendations that he's pulling in from the county, and he's also working with other partners in the area to have these important discussions. And the more discussions that he's comfortable with and he can bring back, the better off we can make decisions from. And it's going to be important as we start to reopen our city and reopen the government as to what are the best practices that got us to this point, to figure out how do we reverse our actions and get back to some sense of normalcy. And what that is in the future, we don't know yet. But he is, as we speak, he is homeworking on our plan on developing a Gantt chart to find out how we're going to open up the city, and we'll hopefully have that Friday afternoon or Friday morning for your review. That's
fantastic. Thank you so much.
Thank
we
you.
appreciate that. Okay. Well, this will lead right into question one then. Do you think reopening our city is a smart move right now? Our numbers have been staying low because we are staying in. What measures are being taken to keep it this way when we reopen back up? What's being done for the families with small children that can't be left home alone because of the no school for the rest of the year? So I think that's a lengthy question. We can take in different parts, and for our participants today, I would ask to chime in when you feel it's helpful to the discussion. But I'm going to first start with Chief Forte.
Thank you, Mayor. Based off the early part of the question, and I'll take a stab at that first, is much of the decision-making will be coming from the state level. Governor DeSantis's Executive Order 20-91 is set to expire on April 30th, and what it's going to look like after that, we don't know yet. But what we're doing is planning on, if he opens it up to a certain extent into phase one, which is off of the national framework, What's the city going to look like? What are we going to do from that point on until it gets to phase 2, and how long is that going to take place? We don't know how long phase 1 will be. It could be a week, it could be a month, it could be 4 months or longer. It all depends on what the criteria are inside of phase 1, that we hit those benchmarks before we move to the next phase. Certainly you don't want to open the floodgates. You don't want to have everybody just rush right out. But if we can do it in a controlled manner and we do it in a methodical way, we could then look at opening up the city in the best way possible. So based off of that information, we look at things like symptoms, hospital stays, how many people are in the hospitals. We go into testing and contact information, which I'm sure Bob can speak about. But ultimately, it's going to be the plan, and the plan is going to be very slow and methodical. If you test the system in the first part of phase 1, is still the isolation of those who are most vulnerable, those who have health issues, those who are in a position of older than 65. They're still the most vulnerable, and you just can't open everything up. And those people that are going to be allowed out in phase 1 are going to have to be cognizant of the people that are going to be around them and still use the face protection and the distancing that comes along with that.
Bob, did you want to add to that?
Yeah, and I think Dr. Bickle would like to as well, but I'll start. Appreciate your comments, Jerry. Yeah, what we're going to be looking for from a public health standpoint is data, things like hospitalizations that you mentioned, number of cases. We would like to see the cases on the downward slope and kind of hitting 0 for us to be real confident and feel good and better about, opening things up en masse in our community. We look forward to that day, and we just think that kind of indicator is just very critical before we opened things up like they were opened prior to the start of this pandemic and the virus. Positive cases are still being identified in the community because we're doing more testing. More testing will result in more positives, so we do expect that over the next couple of weeks. Dr. Bickle, what's your comments about opening up businesses in the economy as it relates to and indicators from the health standpoint?
Well, people should be aware this is an experiment that's going on all over the world. Every country is dealing with this, and you're walking a line between opening things up and then risking, contagion. You got to really watch what you're doing. There's no perfect solution, and it's something every area has to deal with. One of the key components is increased testing. Now, increased testing is more important than ever as we get ready to take this next stage. We need to be finding basically every symptomatic case and using it as kind of a sentinel indicator that the spread might be increasing. Also, hospitalization increases if it happens. So it's and then that's where there's a role of antibody testing to get a better idea of the past prevalence of this in the community. So it's kind of a dance that you go through between and that every country is going through between monitoring this and hoping that the public health and case containment measures will be adequate, and that you don't have to, as you loosen up these social distancing policies, that things don't go south. So it's a delicate process, and all the people involved will be communicating actively. We're just going to have to work our way through it.
Yeah, and I thank you all for those comments. Again, this is a challenge, I think, to each of us because we do weigh a lot of the factors that come at play here. And I also want to say that also each community in itself is different. Right. I speak to the mayors all the time. We're in constant contact. We have 5 cities within Flagler County that are very different in population size, demographics, density, the denseness of the population. And so we all take those items into account when we are making these decisions. We do rely a lot on the data and the science and our experts to help guide us as we go from phase to phase. And our residents have been unbelievably resilient throughout this whole process. We could not do that, frankly, without their taking this as serious as it is, because They have practiced the social distancing. They have stayed inside. I believe that's why it's kept the numbers at a rate that we believe are as low as possible right now. But I can speak to Palm Coast. You know, we get questions often about trails and parks and things like that. We are limited in our resources. You know, we operate from the standpoint of we're not always in response mode of global pandemics or hurricanes or wildfires. We're prepared. However, the day-to-day operation of the city is managed also with the services we provide at the lowest possible cost to the residents possible. So that's a balance that we try to ensure we're not taxing the system as we go through this. And the system is what's critical. So we will be reopening at one point, as Chief Forte said. It will be done in responsible phasing that we feel is appropriate for our city. So the 125 miles of connected trails, I get these questions a lot. We don't have the resources to actually monitor 125 miles of connected trails, and if it's creating an additional health crisis in our city. You know, that's an area that I know our city manager focuses on and relies on resource-driven allocations throughout this process. Our parks, you know, again, our parks equipment and those things that we know could spread the virus in a way that's catastrophic to our efforts thus far. And so we weigh those as well. So I think everybody needs to understand we are all in this together. We've all behaved like we've been all in this together. And so what's good maybe for Flagler Beach when they make their decisions is a different conversation, but it doesn't mean it's right or wrong. It means those are the conversations that are taking place within those communities. And so we have a different demographic, as Chief Forte said. I was speaking to Bob before this virtual town hall started. You know, we have a population of over 90,000 residents, with a large percentage of those residents fall into that high-risk category. And that's important to note because we do have a lot of residential assisted living facilities within our community. We have a lot of larger assisted living facilities in our community. We've heard the stories around the world that, you know, those facilities have been impacted by this virus. And I think it's the close proximity that's happening and occurring within those facilities. So I really, it's a balance. It's one that we're not working from necessarily a playbook, but we're working from the understanding of the spread of the virus and how it's spread. We've enacted a lot of our restrictions due to that spread and how it's transmitted and the severity of the virus itself. You know, when it's different when you're talking about there's a flu and there's a vaccine for that. There's no vaccine for COVID-19. There is no magical way that we're going to stop the spread other than we know it's containment and keeping people away from each other as much as possible. That has not changed to this date.
Right.
None of that has changed. We're working under the same assumptions we were a few weeks back.
Right.
But our public is getting anxious, and I get that, and people are really being challenged economically, and I get that as well. So I know Chief Forte and his team and our city manager as well will be continuing to work with the health department under advisement of what do you think of these plans? Are they responsible reopening plans? What does that look like? Our residents are not going to understand the fact we're not going to put dates to these plans because that's something we just can't predict right now, and it's not responsible. You know, we could change course dramatically, and it could escalate those numbers to such an extreme amount in a matter of days. So I do think it's important to note all of that we take into account. Again, our population being what it is, our at-risk population, the fact that we've had a major serious situation with wildfires because of the drought index that has really put a trying amount of time on our first responders that are having to ensure that they're healthy and they're safe, because we need them to respond to additional catastrophic events that take place in our community. Does that make sense to everyone up here?
Makes sense. And thank you, Mayor. It's very key, and everyone's on board that this is a public health crisis. It's a pandemic. So that's why data and seeing what's happening in our community and here in Palm Coast is very important to drive these decisions going forward. So thank you.
Thank you. Matt, did you want to, I know the last question is more about, the small children left at home because no school for the rest of the year. I know that you speak to our superintendent of schools often. I know that they're trying to work with just even the Volusia Flagler Coalition as well. I know we have Flagler Cares that's working on initiatives for the mental health, serious mental health challenges, that this can also add additional perspective and weight on the system as well. So I think you're going to be hearing a lot more about, again, some of the initiatives that we're driving. And if there's an issue, with a family member that is in need of care, and they're an essential worker, I know the hospital is providing health care, child care to those essential workers, those frontline workers as well. And I've heard that other ones of our businesses are also offering that service. So, and Matt, did you want to add anything to the first part of that question? Because if you think, I'll read 2, 3, and 4, but they're similar. And I think we want to be just thorough in our answers. But if you want to add anything, that'd be great.
Your response was absolutely excellent, and as usual, and on point. I mean, you really covered it. And just, I would remind people, this is a marathon, not a sprint. I think we all keep recognizing that fact. Our position is not driven from fear. It's not driven from anxiety. The management decisions, the decisions being made here are really coming from a position of strength, and they're coming from a position of proactive analysis and reaction to the best information we have, the data, and what we're seeing, again, to our relevant experience here in Flagler County. You were absolutely right, Mayor, when you said, part of our challenge on a day-to-day basis, and Jerry's analogy of backing back out of a room now that we've, marched into it very quickly, is that this is a lot about resource conservation. We had an 8-acre wildfire yesterday. We remain at a very high fire index with low relative humidity coming, which is not a good situation, as we know. Again, not fear. We're talking about data and facts. We're heading headlong into hurricane season, and so, our challenge in this reopening discussion is how do we ensure that we can continue to provide the first-class life-saving and emergency management responsibilities that our citizens expect, and that we deliver through, an event that ostensibly is going to last 6 to 8 months more, in addition to a wildfire season that always has, as this community knows, a history to be unpredictable, on top of a hurricane season that can be extraordinarily unpredictable. And so, again, we're really coming at this from a position of strength, not fear, but also being realistic and saying there are certain benchmarks we have to understand to hit as a community. We'll continue to do the best we can to deliver essential services, to make sure we have our first-class responders fully resourced. To your point about trails and parks, it's a tremendous network. It's a gorgeous network. We know that. And we have, as everyone knows by now, and I'll repeat it, but we've reprioritized those resources that would normally be monitoring or maintaining or doing playground safety checks. They are performing critical emergency management functions for our community now. So again, it's this resource management conversation. I've been asked, again, I'm going to bring the issue up about opening public restrooms, and we don't have the resources right now for PPE and supply chain disruptions. We do the best we can, as many are right now, to manage cleaning and sterilization supplies on a large scale. And again, we were proactive, as Jerry mentioned, since early January with this. We ordered these essentially room-size sanitizing foggers that are state-of-the-art. We just got them in. Thankfully, we ordered them 7 or 8 weeks ago. So managing our resources to do the right thing for our community, to do the right thing by our citizens and our leadership, to do the right thing by our employees, will continue to drive a lot of the decisions we make when we know we can responsibly continue to move forward.
And to question 2, 3, and 4, because that goes to that, and again, we're not going to be able to give dates to these, but I think just acknowledging and maybe even If you want to just address again the business, non-essential, essential sort of discussion of what's currently opened, what some of the discussions taking place of what can safely, be back open. We've heard the reports all across the country that some of the governors that have made the decision to reopen that state, those businesses like the gyms and the tattoo shops, I know, that still remains a concern for the health agencies that are responsible for managing this. So I think, to question two, we need to open business now. When are we opening businesses, and what businesses will be first to open? I think that's going to go back to that point of what types of businesses would make sense for us to do in phased approach that would not continue to really be a detriment to the spread of this virus. I don't know if it's something you've discussed as a health department or the Surgeon General has given any ideas on.
Yeah, I did ask at a call. We have a daily call, everyone, with the Surgeon General and what we call our ESF8 desk in Tallahassee. It's the Incident Command Center between Emergency Management and Department of Health. And we did pose the question, myself and several other health officers, please give us guidance. We see that things are heating up relative to opening up businesses in the economy. We want to be able to match the public health concerns and issues with these issues regarding the economy, and one needs to help drive the other. So please, work on guidance that can be applied at the state level and at the county level so that we can share that with our communities. So that request has been made, and we'll stay on that this week because we think direction from DOH, the Surgeon General, Dr. Scott Rifkes, and his team in the Bureau of Epidemiology is going to be very important for us to navigate these next few weeks.
Right. I know, Chief, if you want to add something.
Yeah, Mayor. The one question about the person who has a lot of senior clients, elderly clients, there's an opportunity for the city to work with all the people in business that we can develop the questionnaire that they need to call these folks and ask the questions on how they feel, how they are, and what is their condition before businesses should go back to these people's homes. I think if we open up the door and we start looking at, you can go do business now, that's great for the general population, but you have to look at what the vulnerable people of the community are at risk. And when you've got someone who's got 5 or 10 tickets on their daily roster and they go from house to house to house, they may be bringing whatever it is from the last house to the next one. So we can be proactive in dealing with the people in business in the community and ask them to come up with their own questionnaire on how they deal with certain members of the community when they respond to their house for normal services.
And I think that's what's going to be helpful in those conditions. I own a commercial cleaning company. I suspended all my residential cleaning on March 17th. Most of my clients are elderly or compromised. So again, the timing is going to be different from business to business, right, when we discuss those items. And Dr. Bickle, did you have anything to add as far as just even the thoughts on those essential, non-essential, again, those that are impacted and really could, frankly, cause an additional wave of transmission? Has that been a thought process of yours or any material you've been reading on, watching the world go through this?
Actually, Melissa, that's that's the main thing I've been reading about these days, in addition to testing and antibodies and tests and stuff like that. Two things that just points I want to make. One is people have to keep in mind that this infection has gone from a few scattered cases in the country from travelers coming in from other places to almost, we're approaching 1 million cases now, over 800,000 now in 2 months. So if people don't think it's a challenge to contain this when we're already going to be starting from a place where there's infections all over the country and trying to contain it as we open things up, they're not thinking, deeply enough into how challenging this is. And the other thing is that a number of the countries that have done really well opening up developed incredible public health infrastructures after the SARS epidemic to deal with this, from integrated database systems, tracking systems, massive personnel to do this. We're starting from kind of a standing start here, so it's especially challenging with the resources we have. So this is a monumental undertaking, and the risks are high. So I think proceeding from the place of prudence and caution that as you're doing is totally appropriate in this setting. Thank
you for that. And okay, this is more of a business question. I'm just going to just state what resources we have. I'm a small business sole proprietor that does not have a business account at my bank. Who in Flagler is helping these kinds of businesses get a PPP loan?
So all the resources I'll talk about are on the virtual Palm Coast Virtual City Hall on our COVID-19 landing page under the Business Resource tab. Very easy to find. You'll see it in the second row. PPE loans, as of yesterday, were actually not being funded anymore by Congress. They had tapped out of the funds. As of this morning, it is being announced that they're adding additional, I believe it was $50 billion to this fund. There are a couple ways to get access, get assistance, and get counseling through that. And again, you'll find all these links right under the Business Resource Assistance tab on our virtual City Hall. One is the Florida Department of Economic Opportunity, and they're doing counseling on the payroll protection loans, as well as the bridge loans that are available and could continue to be available to small business. There is a self-assessment you can conduct that supposedly is very easy for anyone to go on and it will ask you questions that begin to steer you towards what resources may best fit you or what you're eligible for, and that is floridadisaster.biz, and the state has established that assessment. Additionally, if you're looking particularly for information on the PPP loans, home.treasury.gov and SBA.gov. The SBA local will provide counseling online, and our local SCORE chapter is directing people to SBA.gov and to home.treasury.gov for specific counseling for businesses. Again, all these resources are under our virtual City Hall tab. They are linking to the most up-to-date, that's why we have this tab, accurate websites and questionnaires and assessments to help small businesses in our community navigate through this event.
And that's all under also the Palm Coast Connect app.
Yes.
So I would suggest everyone on here is on the Palm Coast Connect app. We're working through that. But it allows us to not only collect that information, but get that information out to the residents that are asking these questions specifically. So it's important that we continue to drive this process through that, as the data will help us manage and respond in a responsible way. So speaking of testing and cases and masks, we're gonna jump into a few of the questions that I believe frankly apply more to the Department of Health's area of expertise and responsibility. I know you mentioned at the top of the hour how many residents in Flagler County have been tested, how many tests are available for residents to be tested, and are you planning on making wearing masks a must out in the community? If you want to take the first two and then even the third, and then if anyone else would like to respond.
I'd be glad to,
Thank
Mayor. So 1,054 folks have been tested in Flagler County. We're real thrilled that last week we got the drive-through test site opened at Daytona State College at the Palm Coast campus from 9 to 1 throughout the day. It's happened yesterday, today, the rest of the week, 4 days last week. As I mentioned, 119 folks were tested last week, 79 just yesterday. We did get quite a few positives from both these opportunities, and so we're doing contact tracing. But at the Speedway, at the Daytona Speedway, testing is happening by Advent Health Palm Coast, and Advent Health Systems in a big way there. The Childcare facilities, Aza Health on the Parkway, they're testing. Of course, the health department. At the community test site that we mentioned, All you need to do is meet one of the clinical symptoms, whether it's a fever, a cough, shortness of breath. Especially we're looking for people who are immunocompromised, people who have underlying conditions over the age of 65, healthcare workers, first responders. This is the group that we're most concerned about. So please contact the county. I don't have the number in front of me, but you can call Monday through Friday from 9 o'clock till 5 o'clock in the afternoon to get an appointment to get tested at our Palm Coast Campus College site. And again, this is quite the partnership between our city's emergency management, health department, Advent Health, EMS, Fire Rescue College, volunteers from Flagler Volunteer Services, the CERT team who's handling traffic. It's quite the operation. And starting next week, Advent Health Palm Coast is going to take a greater role in organizing and coordinating this effort. And of course, Diagnostic Solutions, our local lab in Palm Coast, they've been doing the testing, and turnaround has been within 24 hours. So thank you, Diagnostic Solutions. Okay, let's see. Contact tracing. Yeah, that is probably the most significant public health function among the most that we're focused on right now, Mayor. People who test positive, we get right on it in terms of identifying the prolonged close contacts of these individuals, to interview them as well, to provide them guidance, to see if they meet clinical criteria for testing, see how their family is doing, tell them to monitor for symptoms. So we stay in contact with all these individuals. And one positive case could have 2 close contacts. Another one that I know of last week had 15. So we do not miss a soul relative to following up on these individuals. So basically our public health nurses, they serve as detectives, as disease investigators, and that's what we're really focused on at the moment.
And I think, about the masks, are they a must out in our community? I know the CDC has come up with some requests about that, and again, I know that our essential businesses that are open have created tape in certain businesses to create that social distancing, to mitigate the spread of this virus as well. Can anyone, here just speak to their thoughts on, are masks mandatory? Should they be mandatory? And what are the plans and discussions going on around that?
Well, Dr. Bickle, you and I have talked a lot about this subject. I think we've come to the conclusion, and please chime in, where we are recommending that if you're out and about, you're going to the grocery store, you're going to the pharmacy, you need to run an errand, wear a mask. If you don't have a mask, wear a cloth over your face or a scarf. But that's our recommendation, because the asymptomatic rate, we're hearing from studies all over the country that the asymptomatic rate is much higher than we originally thought. In some places, studies have shown it's upward 70–80% of people with the virus have no symptoms. So for protection for all, we are recommending the mask. Steve, did you want to chime in about that?
Yeah, well, you summarized it very well. The additional thing, though, is looking at countries in Asia that have been particularly successful in containing this. One common ingredient seems to be virtually universal mask wearing. Yeah. Whether you're going to make it mandatory or not is another issue, but I would certainly strongly encourage it for everybody as much as they can possibly do it.
That's actually extraordinarily helpful. Again, that goes back to that. So, again, for the regular mask, if you don't have one, a bandana, a scarf, something like that will do?
Yes, absolutely.
Okay.
Absolutely.
Some type of facial covering?
Some kind of facial covering, you bet.
Chief?
I was able to pull up the number for the county phone number for signing up for Daytona State College, and it's 386-313-4200.
That's great. And, for those that are listening in, again, this is also being streamed live on WNZF as well. We're trying to get to as widespread of the audience to get accurate information as possible. I do think it's important, again, that we recognize we do have a local laboratory. Tony Hoffman, the CEO, couldn't be here today. He got pulled away to a statewide meeting, I'm sure, to get further information to help our community even further. And Wally DeQuino from the Advent Health Palm Coast, the COO, also had a conflict today in his schedule, but Advent continues to work very closely with our health department, our different stakeholders in the community, and is in constant communication. So continue to check in with us, because that information is always being updated, always being changed, to make sure that the information our residents have are the most up-to-date data and everything else. And on the health department site, when is the information for the testing updated?
Oh, it's updated twice a day. So when you go to www.floridahealthcovid19.gov, you can go to our website at DOH Tallahassee, and it gets updated twice a day at noontime and by 6 o'clock at night for number of cases, number of people tested, by county, by zip code, by city, by long-term care residents. So good information there and great guidance. And I see two questions here, Mayor, about what percentage have recovered from the virus. Well, I'll tell you what, that is something that we want to know ourselves.
Okay.
We have asked Department of Health in Tallahassee to please make that available to all of our counties, because, of course, we have good data which gives us an idea of how many folks have recovered, but we want that to be verified and confirmed, and we think that'll be valuable information for our community. So they are processing that as we speak. The issue there is definition of what is meant by recover. So that's what they're grappling with, and so hopefully we'll have those numbers real soon, because we've asked for them.
That's great. And will there be testing for all to find out if we have the virus or antibodies? It goes to how many tests are available. I do think it's important to note the test kits that are supplied and are offered, there's other equipment that's required to not only test those that are at risk or are symptomatic. I know that the health department early on had a strategy around testing, and that was the healthcare workers and the first responders, in an effort to make sure we were recognizing their safety and understanding, because they are in the highest rate contact with people because of their everyday jobs, puts that in direct contact with as many residents as possible. But can you just talk, because again, I think a couple things. The quick turnaround of the testing is helpful because there is a short supply of the PPE.
Right.
And then the swab itself has been an interesting discussion.
Yes, it has. So right now we're doing diagnostic testing still for the most part in all of our communities. And it's either a nasal, an oral swab, throat swab, or a sputum sampling. But for the nasal and the throat swab, you need a device that collects the sample. You need then to take the swab and the sample. It needs to go into a collection kit or a tube with a liquid to interact with that specimen. Then it needs to be carefully packaged. Then it needs to be shipped off to a laboratory. In our case, our Diagnostic Solutions lab in Georgia, outside of Atlanta. And then we hope for the test results to come back within 24 hours. So it is with diagnostics, it is with our public health labs, but because there is just such a huge demand to get these tests processed, some of our larger commercial labs were taking 7 to 8 days to get results still. So that's what we're focused on right now, to tell us who has the virus right now today through this PCR testing kit. But the parts and pieces, right, including the PPE. Sometimes we have a shortage of these things, so we kind of scrounge around and kind of compete for each other still to get all of these supplies. But for right now in Flagler County, we are okay. We have enough supplies and PPE to do the current level of testing. So the next kind of testing is the surveillance testing, and I'm going to punt to Dr. Bickle because he has studied this a lot. And Steve, this is the antibody testing. Can you share your thoughts about this?
Yeah, people have to keep in mind that testing has to be strategic. That I think people sometimes have this view that like testing answers everything, and it's not like that. If you test low probability patients, it's almost a waste of time, and you're going to get as many false positive tests as real tests that are positive. So you have to really know why you're testing and have the test selected appropriately. For instance, when people have COVID, there's a maximum of about 10 days that they have virus that you can detect. And it's detectable to varying degrees from the various sites. Some of the tests are easier. It's most detectable from the lungs, but we're not testing there. It's less noticeable in the throat. So if you do the wrong test or you do the test at the wrong stage of the illness, you get a false reassurance you don't have it, and it's not really useful. But there are some very important uses that we'll have for these tests going forward. One is eventually, like especially as we move to the second stage, we would probably want to be testing pretty much anybody with upper respiratory symptoms, even mild, because we want to know how many cases are out there. Right now, we're mostly focusing on the sicker patients that are more at risk. But going forward, we want to really have a good sense of how many cases are out in the community. So people will be getting some of their wishes granted in terms of there are more tests that will be available, and also we'll be wanting to test the milder cases to see how much is out there. And then the other thing is the antibody test. A lot of people think all these things about the antibody test. One thing is they have a false positive rate of a few percent, even the best tests, and that's because they're reacting to related viruses that you can't really separate out other than in research situations from the SARS coronavirus 2. So, and that just goes with these tests, and that's the best tests around. Tony Hoffman of Diagnostic Solutions, they have these tests. So you got to be careful if the percentage of people in the population is only 1% or 0.5%. Your test might tell you it's 2 or 3, but it wouldn't really be accurate. So that's one issue. And the second one is that it's not really that purposeful to test people who haven't had any upper respiratory symptoms in the last few months, because they're just, even though there's asymptomatic cases, they're at less risk. They're less likely to have it. So you want to test the people more likely to have it, so you'll identify more cases. So it has to be very strategic. But this is a known science, the science of tracking and modeling and sorting this out. And we're working with people. Bob, you've been in touch with the epidemiologists at the state level, and so we're going to do some of this stuff. The other thing is, if you do surveillance, you've got to do a decent sample of the population. You can't just you have to sort of do it so it's representative, so you can draw informed conclusions. So there's a lot more to testing than meets the eye.
And we're looking forward to the day where we can do surveillance testing so that we can identify, okay, what percent of the population truly was asymptomatic, walking around with the virus, and then who's had it? Who's had it over the last 2 to 3 months, so that we can get a good feel for spread. And then this data can then help us make decisions about opening things up.
Well said. Chief?
Dr. B, there's another question to follow up is, if you prove that you've got antibodies, can you clarify that you can still possibly get COVID even if you're carrying antibodies? Because I'm running across people that are thinking that if they've got the antibodies, they're free from getting the illness down the road.
I could answer that one. There's a lot of speculation about this, and most likely, if you've got first of all, you have the antibodies because you've already gotten over the infection. So you've already demonstrated your immune system is able to do that from scratch. That's one thing you have going for you. Secondly, in most cases, in most illnesses, the antibodies are protective. That's how people recover. The question is, if the virus mutates, which could happen but may not happen, or it may not happen in a way that's important to get the virus to be, not susceptible to these antibodies. If it does, it won't do it like next week. It might do it by next year. So the antibodies are likely protective for some time, probably through this whole year. And thirdly, that we're pretty, in most illnesses, antibody titers do correlate with immunity to reinfections. We won't know that until we have more, there's more data, until we've had, this thing has been running for a couple of years, and we'll see what happens. That's just not knowable at this time. So a lot of the stuff about antibodies being protective or not protective is just pure speculation. We just don't have the data, but there's every reason to assume that in most cases, and maybe the vast majority of cases, they will be protective.
So that's a very comprehensive answer, and we really appreciate it because, again, there's a lot that goes into this that is very complicated, and it's why we need to have this continual conversation and why our residents need to understand the decisions we are making are a direct reflection on trying to keep them as safe and healthy as possible.
Correct.
That is all of our priority. That's all what we're dedicated to. Yes. This goes back to more of the businesses. When will vacation rentals and Palm Coast be able to be rented again? That goes back to the direct question in the beginning. We know that Governor DeSantis will be coming down with some Governor DeSantis will be coming down with some of his suggestions and orders. And then I know that we will continue to have conversations locally, and I know our team within the city of Palm Coast has been proactively working on a reopening strategy, one that is reliant on the science and data, one that is reliant on the health professionals that are guiding us, and then have it done for our community in particular with the specifics. So more to come with that. Again, we are trying to do the responsible thing here and try to make sure that we're not putting people at further risk. So Matt, I'm going to put this question to you. Considering the stay-at-home requirement and frequent hand washing and extra cleaning around the home, could we get a break on the water bill until the stay-at-home is lifted?
So great question, and again, we've tried to provide those breaks. I would say yes, they're already in effect. We have, at this moment, and now for going on 6 weeks, we've suspended any late fees and any interest around any late bills. We've also not been shutting people off for lack of payment, and we've been working very hard to work with our residents to make sure that you have water and sewer, and that we're doing the best we can do to help you manage your utility bill. And if you're unable to pay, we have resources available that we've been pointing people to, and certain ways to provide assistance. So we're doing what we can. At the end of the day, we are responsible to a utility system that runs much like an enterprise and to bondholders in that system. So rates have been established under policy and ordinance. We're going to continue with those rates at this point, which are reasonable. Additionally, one of the ironies I think everyone is seeing and facing, these masks are a great idea when we talk about supply chain disruption and costs. It wasn't that long ago you could get a box of surgical masks for $8, I believe it was, and now if you can get one, they're upwards of $80. And we see similar supply chain challenges in the chemicals we use for treating our water and our sewer, and in providing those services. So our rates are well adjusted at this point, and we'll continue, again, to your point, Mayor, respond as we can, and as if conditions could or could not dramatically change, to keep being fair, being reasonable, and also making sure we continue to be able to provide this essential service to our community.
And one of the questions came in, I think it's actually a good question. I think we have to figure out a way to do it. Signing into Palm Coast Connect every single time. We want to use it, but can't we have a function to sign in or facial recognition sign in? I think it might be something worthwhile looking at.
That was a phenomenal question.
Right?
Because right away I signed in Face ID on my devices, into apps and things so many people do. And so I appreciate that question tremendously. And yes, we actually had already sent a note out to our staff to say, can we accomplish a more seamless or simple or remained logged in? Because again, I know we had a question last week, why do I have to sign in? And it's because we really need that engagement. We want that engagement. We value the engagement of our residents. It's so crucial to helping us understand what people need to know, what they need from the city. And so, yes, I think making this as simple as possible is great, and we're going to get on that. So thanks for that great question.
Yeah, and you might want to just talk briefly, and then I'll ask for closing comments from each of our participants. Just briefly on the data that's being derived from the technology that we've been able to utilize.
So again, that data we're getting on a daily basis, I like to call it two different sets of data. There's the actual apparent data that we're using to make decisions. Again, we saw a spike in PEP pumps, and we had more of awareness this time. So messaging went out, and we're still having people flush paper towels and wipes. A lot of the wipes you buy at the store say flushable wipes. There is no such thing as a flushable wipe. So we're asking you, please don't flush your wipes. Please don't flush paper towels. It does put a strain on the system when we're out replacing, PEP tank pumps and having to respond to these calls. But so we get that hard data. We understand we're able to make much better decisions on a daily basis. And then if you really are reviewing the data, there's these incidental awarenesses we have. There's data management and there's data nuance is what I call it. And part of what we realized, there's another great case example, real-world example we just discovered this week, was that we are seeing and have a sustained significant number of after-hours call-outs with our utility workers. And that really generates the question, when we can look back now in time over the last 6 or 7 months of using our Palm Coast Connect and our field service Lightning, I think we can demonstrate a case that we should have a crew that is dedicated for different work hours. Instead of the traditional 7 to 3, we might have a crew now that works from 1 p.m. till 8 p.m. when our calls stop. So it's all about managing resources. It delivers them at a better cost instead of paying overtime. Perhaps we have a separate crew. It helps us be more responsive because we can see that sustained spike in what we now consider after hours utility call-outs, helps us be more responsive and reactive to our residents and engage better. So we're using these data sets along so many lines. As some of you know internally, our community might not know, early February we put online a human resources tracking piece to Palm Coast Connect. And again, we looked at two things: how many people are here, how many people are working remotely, how many people are calling out sick. It helped us to do surveillance on our human resource workforce to understand where our strengths and weaknesses may be. We're able to tie that data set into the fire department calls and understand that we were seeing an extraordinary number of call outs to residences that weren't feeling well and concerned they may have COVID-19. So it's those priority things. And then again, the nuance of the data. We said, hey, if we were to have 25 or 30 sick outs in a department in one day, do we really have an illness, or do we have a problem we didn't address as managers to say there's anxiety around, I don't have a face mask, or is PPE sufficient, or are we distancing it at work enough? And so it helps us really manage these situations from a granular level all the way, the very detailed granular level, all the way up to those big issues, and helps us issue spot ahead of time. And so again, this data, pure data that we're getting from our systems is really driving daily, how we manage, how we prioritize resources, and more importantly, how we're going to continue to do that a month from now or 2 months from now with the best information we have to be responsive, and to your point, Mayor, to do it on the most cost-effective basis possible. I know that conversation will only be heightened as we move forward. How are we containing costs? How are we responsibly managing taxpayers' dollars? And we're now able, I think, to do that in ways we never could before.
Thank you for that. Chief, any closing remarks?
I do. If we tried to put this down on a tabletop exercise 4 months ago, we really would not have given it the significant attention and the seriousness that we've actually learned in 2 short months. And it's been 2 short months. For the long term, we've got the ability to look at how we operate today and assess, is this the way that we want to continue to operate, or in some fashion, or do we want to go back to the way we used to do things? And if we can use this as a learning opportunity and scale it to an event of this magnitude, and then come out with a better, effective, efficient way to operate, I think we have gained some knowledge in this. The second point I wanted to make is part of learning. There are other states that are going through the reopening process as we speak. Texas, for example, Governor Abbott's moving forward with many ideas on how to reopen, and they are entering their phase 1, as they called it. We have the ability to see how they have successes and challenges. And if we can learn from those states on how they have better ways of opening things, it would make our institution of reopening a whole lot better. So I'm sure between Bob, the county emergency manager, and the state, we can figure out how to safely open up aspects.
Thank you so much, and thank you for your continued service for our community.
Thank you.
It's incredible. Bob?
Thank you, Mayor. So, you know, our main focus right now truly is three things. Testing and determining the number of positive cases as much as we can. Number two, the contact tracing, now that we're testing more people, more positives are surfacing. So we want to just do that detective work and follow up on those prolonged closed. And then the most vulnerable in our community, the third major issue that we're focused on is the elderly in our nursing homes, long-term care facilities, the small adult homes that we have, of which there are many in our community, and group homes for persons with developmental disabilities. There are 71 of these facilities in Flagler County, the most, of course, being in Palm Coast. So we are actually started yesterday, 6 teams of 2 are going to be going out to visit all the facilities face-to-face. We're there to support and to work with the administrators and the director of nurses in these facilities, especially the larger ones, just to review a checklist, document our findings, and just ensure that restrictive visitation policies are working, make sure that both residents and staff are being screened on a daily basis, and that if there is a case that surfaces, that everyone knows what to do, that we're all on the same page with respect to our response, because we do not want to see an outbreak in any of our nursing homes or ALFs or other long-term care facilities. So the Department of Health is going to be enhancing our efforts with the administrative teams of all of our 71 facilities, just to make sure that the right thing is being done and that we're constantly vigilant in protecting the most vulnerable in our community.
Well, we couldn't do it without all of our stakeholders and partners, so thank you to the Health Department. Dr. Bickle, you are always a wealth of information, and I continue to say I learn something new from your guidance every single day. So, and to our residents, thank you again for continuing to heed the warning. Continue to stay informed and up to date with current information. That's how we're going to get through this together. Thank you so much for your continued contribution, and you're taking your part seriously. We will get there. You will hear more from our team on what the plans and the rollout will be. Please, 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 if you can, contribute to Feed Palm Coast. This initiative will help improve people's lives that are struggling tremendously right now. If we have not answered your specific questions, they will be put on our site following this meeting with the answers. And again, continue to tune in to your virtual town halls. We look forward to your continued participation. Thank you.